Hi, thank you for attending Chief Marine Group's Benefit at a Glance. The benefits we will be going over will begin June 1st, 2023 through March 31st, 2024. This is the time when you can enroll dependents, waive coverage for dependents with no additional information asked. After June 1st, 2023, and you experience a life event, you will need to provide supporting documentation. A life event is if you were to get married, divorced, birth of adoption, loss of a spouse's job where coverage is maintained through the spouse's plan, death of a spouse, and death of a dependent. Remember, you only have 30 days to make these life event changes, and you must provide supporting documentation. On the front page of the Benefit at a Glance, we included information on how to search for a medical provider, a dental provider, and a vision provider. You will have three Aetna plans to choose from. All three Aetna plans use the same network. You will have copays for primary care, specialist, CVS Minute Clinic, preventative care, and urgent care. I want to go over with you on what a copay is. So in the first plan, you have a primary copay of $30. Remember, this is the fixed amount you pay for a covered health care service. Usually when you receive the service, the amount may vary depending on the type of covered service. Deductible. A deductible is the first dollar that a member will spend before the carrier, which is Aetna, will share in the cost. Out-of-pocket maximum. This is the most that you will spend in a calendar year before the carrier is responsible for your care at 100%. All three plans are at 100%. You are offered as well as prescription drugs, all at a copay. We've included information for you for the RX information. Remember that some of the grocery stores have pharmacies in them. So some Publix's, Walmart, Winn-Dixie's. You just have to go to them and present your prescription and see if it's a covered formulary that they have, and you would not even use your insurance card. You can ask your doctor for coupons. You can ask if there's any specials that are going. Providers definitely get a lot of stuff from their prescription vendors, and sometimes they can share in that. You can also find GoodRx will give you information on where to find cheaper prescriptions as well. We've included information for the Aetna member website. If you have not already logged in, we strongly suggest that you start as soon as your benefits begin. Through the member portal, you'll be able to review your plan benefits and coverage details, see healthcare costs and how much it's covered for your plan, what your deductible is, where you are in your out-of-pocket maximum. You can view and pay claims easy. You can also access your member ID and have a digital copy there. Aetna also has an app for your telephone that you can download as well. This is information on how to download a digital copy of your member ID. Minute clinics. So at the beginning pages, we showed that minute clinics were done at a zero cost share. These are some of the benefits that are covered at the CVS's. Aetna also provides a virtual care solution at a zero cost share for all members enrolled in the Aetna. As you go through here, you can see how it is covered, the convenient way on how you can seek care. Aetna also offers their members $100 for health support products for over-the-counter CVS brand and non-prescription health and wellness supports. We've included information on how to get started with that. Aetna also has a benefit called the PeerFit. How it works, you create a PeerFit account. You can choose a studio or gym, reserve a class, show up and work out. Dental. You have a PPO dental. that offers you in and out of network benefits. There is a rollover benefit as well. So if you were enrolled in this benefit last year, you can log into your Guardian member portal and see if you have any additional rollover monies. That would make your benefit that has a limit of $1,000 potentially up to $1,350. You have no charge for preventative cleanings. You get 2 cleanings in a 12-month period. For other services that need to be done, you will have to meet the deductible and then share in a coinsurance amount. Additional information can be found on Employee Navigator under the Helpful Resources tab. Vision, the network is VSP. You have a $10 copay for office visit. You have $10 copays for lenses. There is a $150 frame allowance and a 20% over the balance of that as a discount. There are no additional discounts given at Costco, Walmart, or Sam's Club, and a few private practices. That is because the frames have already been discounted. Contact lenses, you have a $150 allowance and then 15% over the balance of that. Again, no additional discounts at Costco, Walmart, Sam's Club, and some private practices. Examinations can be done every 12 months, lenses or contact lenses every 12 months, or frames every 12 months. Please remember that you cannot do frames and contact lenses in the same year. There is in and out of network benefits, but as you can see, the reimbursement on the out of network benefits is very low, but you do have the choice. There is an employee assistance program being offered to you at no cost to you and your family. You can have up to 6 face-to-face video and telephonic counseling sessions. There's a 24-hour crisis helpline, online peer support group. There is a chatbot. EAPs can assist with financial help, legal services, online legal forms, child and parenting services, adult and elder care services. There are webinars and training. Please remember, EAP is a confidential benefit. Nobody at your work would know if you were using the benefit. So please, it's there for you. Basic life and AD&D. Your employer provides you, if you are a full-time eligible employee and have satisfied your eligibility requirements, a one-time salary not to exceed $100,000 of basic life, along with accidental death and dismemberment. In addition to the basic life and AD&D benefit, you have the ability to enroll in voluntary life. We've included the information on how to, the benefits that you can have. If you were to purchase life insurance as an employee, you can do it in 25,000 increments, not to exceed 200,000. There is a guaranteed issue amount of 25,000 where no questions are asked. If you did not enroll you, your spouse, or your dependent in the voluntary life insurance at the time it was first time offered, or your newly eligible window, then you will be responsible for completing an evidence of insurability, EOI. That can be done electronically on Employee Navigator. It is the most secured and fastest way to get to the underwriting. If you had life insurance and you wanted to increase the amount that you have, you will have to complete the EOI before it is even considered. More information can also be found on Employee Navigator under Helpful Resources. There is a paper that you can fill out for the evidence of insurability, or do it directly online, which is what I strongly suggest. Short-term disability. Short-term disability pays you in the event that you were to get sick or injured. It pays a portion of your weekly salary at 60% up to $1,500 maximum. There is an elimination period of 8 days for injury and 8 days for sickness, and it does go for 12 weeks. LifeLock, there are 2 benefits being offered on LifeLock. Again, additional information can definitely be found on Employee Navigator under the helpful resources. But if you were to become a victim of identity theft, LifeLock will help you with our $1 million protection package. This includes reimbursement for stolen funds and coverage for personal expenses. You will be notified if something was to be triggered through an email, text messages, how you have it set up, or a phone call. Again, there are 2 plans to choose from, and that can be found on Employee Navigator under the helpful resource. Teleadvocacy, healthcare, navigation, financial well-being, and pet care. This is a bundle of benefits wrapped up into one payroll deduction. You can see there is a Teladoc benefit here at a zero cost fee. There is an All Right Navigator. The nice thing about them is that if you had claims that you didn't understand, they can help you navigate through that. If you needed help finding a specialist, they can help you with that as well. They're trained and able to help you in a lot of solving billing issues. There's also alternative medicine, pet care, hearing aid, diabetic supplies, vitamins. Remember, this is not insurance. This is a discount plan, but it offers you all of these benefits for one payroll deduction. This is the information on the All Light Navigator. There is an app to download for the My Benefits work, where you would find all your benefits. You would find the providers that are participating. Beyond Med. Beyond Med is a membership program. It covers benefits that probably aren't covered under your health insurance, like bariatric information, mental wellness, med spa, surgical vision, vitamin infusion, weight loss, and much more, IV therapies. There is a concierge desk that you can call, and they can help you set up an appointment. If you have a provider that you would like to nominate, they would be happy to reach out to your provider to see if this is something that they would want to participate in. Flexible spending lets you set aside money on a pre-tax basis to pay for eligible healthcare expenses like medical, dental, vision, and hearing, and prescription expenses, plus copays, coinsurances, and over-the-counter items. You do have a carryover benefit of $500 from the remaining balance into the next year. The 2023 contribution was increased, to $3,050. Dependent care is $5,000. You can find what eligible expenses are covered through the FSA under the helpful resource section of Employee Navigator. We will be using an Employee Navigator for our enrollment information. If you are a first-time user, you will select Register as a new user, create a username and password. You will need to provide your first name, last name, company identifier. It is case sensitive, so it needs to be entered exactly like this. Your Social Security, the last 4 digits of it, your birth date. Then create a username and password and select I agree to the terms. And to start your benefits, Returning users, you would log into Employee Navigator, enter your username and password. If you forgot your password, you can just click on Forgotten Password and follow the prompts. Most people have used their employee email address unless you have made a change from that. All documents for the compliance can be found on Employee Navigator. There is also no automatic enrollment, so you must log in, enroll, or decline your benefits if you are an eligible employee. We've included information on how to contact the various benefits. If you have questions or need help logging into Employee Navigator, you can reach out to Colleen Hernandez or Debbie Rito, as well as Janelsa Castillo. I want to thank you for your time, and I hope you have a great day.